Is it recording? Yes. This is, I'm Dawn White. This is my patient, and we're doing our head to toe assessment for leadership. And I'll begin now. Can you state your name and your date of birth? Just make something up.
John Doe, March 3rd, 1997.
Okay. And you've agreed to be my guinea pig for the head to toe assessment? Yes? Okay. And then, can you, neurologically, we're going to start with a neurological assessment on him. His eyes are open. He answers spontaneously. He's verbal. He is orientated. Can you tell me the date?
August 3rd,
4th.
August 4th, 2015.
Who's the President of the United States?
Obama.
President Obama?
President Barack Obama.
Thank you. And do you know what day of the week it is?
It is Tuesday.
And I think that should do us. And do you have any, let's see if we have any pain. So, any pain?
No.
Okay. So he will respond to pain. He will withdraw from pain, localizes to pain. He's alert oriented by all spheres. His recent memory is intact, his remote memory. He's a pleasant mood, upbeat feelings, any depression.
Nope.
Okay. And his expression is one of pleasantness and cooperation. His speech is intact. I'm going to have you stand up for me just a minute. And I'm going to have you walk this way, my way, and then turn around and walk away from me. Okay? And turn around. And come back to the chair. His gait is intact and coordinated. He has no noted vestibular issues. He's coordinated. I want you to close your eyes for me and tell me when you feel something sharp.
I feel it.
Okay. Okay. And then tell me when you feel something on your face.
I feel it.
Okay.
Feel.
So he can tell the difference between light and sharp sensation. His reflexes, let your leg down, are intact on both legs. Okay? And both arms. I'm going to have you push against, I'm going to have you put your foot up so that it can be seen. Push against my hand for me and pull up. And then push your foot down to the bed. Okay, and let's do the same on this one. Push against me. Push up toward your head. And then push your head down, your heel to the bed. Good. And tell me, does anything bother you when I do that?
Nope. And
what about here?
Nope.
So, his coordination, he's able to move both extremities, lower extremities. He's negative on his Babinski. His reflexes, plantar and dorsal reflexes are in good, strong, equal on both legs. He has no signs of weakness. Squeeze my hand. Squeeze this hand. And I want you to push me down. And then push me down. And then push me together. And then I want you to shrug your shoulders. That is cranial nerve. Let's see, my cranial nerve. That is cranial nerve number 9. Spinal accessory nerve. He's able to shrug his shoulders appropriately and let go and relax. So he's able to move all extremities. His skin feels warm to the touch. It's dry with no apparent lesions present. His neckline is symmetrical. His back looks like even. He's got even distribution of hair on both his legs and both of his upper extremities. He's not moist, he's not cool, he's cool to the touch, he's not clammy, he's dry. He has no suspicious lesions, no bony prominences that it would have any concerning. Can you open your mouth for me? And his mucosa is pink and moist with no, lift your tongue up for me, okay? With no, you can swallow, with no noted, any noted ulcerations. Can you stick your tongue out for me and go side to side? Smile, frown, raise your eyebrows, turn your cheek towards my hand, and turn your cheek this way towards my hand. The masseter muscles are intact. Look at me, and I want you to follow my finger. There's his lateral eye movement. And up, over, and down. Okay? Now, I'm gonna just cover one eye. And look up at the ceiling for me. His pupils constrict, they're even about a 3 from a 4. His sclera is clear, white, no noted blood or lesions. His conjunctiva is pink, moist, with no redness noted. Close your eyes for me. Tell me when you smell something.
Smell.
His olfactory cranial nerve number 1 is intact. His abducens is the lateral eye movement, which he's able to follow my finger from side to side. His trochlear is the medial eye movement. It's downward and upward, which he absolutely follows. His facial is the frown line and raise the eyebrows. That's his facial, which is cranial nerve number 7. Sorry. Trigeminal. Clench your teeth for me. Okay, that's his trigeminal, and that is number 5, cranial nerve number 5, and his lateral tongue movement, where he went side to side, that is cranial nerve number 12, which is hypoglossal. So I'm gonna have you swallow for me. His trachea is midline. It's even. Swallow again. Okay. And then his jawline has no lesions. I don't feel any palpable lip nodes.
Yes.
And he passes the whisper test.
Yes.
Bilateral ears, he hears both from both ears. So let's pop this